Hi, this is Hannah Lehman from UVA Hand Therapy. I'm here to teach you just a little bit about how to do your therapy at home after your carpal tunnel surgery. Most patients do really well after this surgery. As long as you listen to your body and you don't do too much too soon, generally people have a pretty good outcome. If you do have any problems, feel free to call the UVA Hand Center and get in touch with a therapist, and we will be happy to answer your questions. We're going to start by looking at the PDF that's attached. There are pictures that we'll follow along with. The first thing you'll see, they're called tendon glides. They move all of the tendons through the area of where you had your surgery. So we want to make sure that all of those tendons are moving so that your body, as it's healing, doesn't accidentally grab onto any of those. The movement's also good to help with swelling in your hand. Again, listen to your body and what it's telling you. You don't have to have perfect motion today, but be persistent, not aggressive. First exercise is working to straighten your hand. You don't want to just do a lazy straight, but all the way straight. The next one, you're going to bend at just those big knuckles. And it doesn't matter as much what you do with your thumb, but you're trying to keep these very straight. Don't move your wrist around. Try to keep that wrist still and bring those fingers down. Then you're going to work on bending at the middle knuckle so that you have a flat fist. Notice the tips of my fingers aren't curling in, so you're going to keep it nice and straight. From there, you're going to come back up tall and pull those fingers in. I call it cat claw or hook fist. So you're really tall through the back of the hand and bending a lot of the two joints at the tip of your finger. And eventually, with all of those motions, you'll get that full fist. We don't expect you to have a full fist right away, but just keep working on it. The next thing we want to pay attention to is your incision is right on your wrist, and that was immobilized in your post-op dressing. So you want to keep that wrist moving back and forth. Nice, gentle movement. You can do it with your fingers relaxed or with a gentle fist. We don't want you doing any heavy gripping, squeezing, lifting till about 4 weeks from your surgery date, because that can irritate the tissues, and they released a little ligament that gives stability to the bones of your hand. So if you start to have pain in the palm of your hand, that's pretty normal. It's probably because you're doing too much too soon. Other things to think about after your surgery are taking care of your scar. So you're going to have an incision with some white little steri strips on it. When those steri strips come off and your sutures are dissolved, you can start massaging your scar. Just putting moderate pressure, enough to wiggle the skin back and forth. And a good test for this is look at your other hand and move the skin enough to see the skin wiggle. And that's how much pressure you should be applying on the incision site. You want to make sure that you start this after the steri strips are off and the incision is well closed, not going to tear anything open. Usually that's about 5 days from when you get your stitches out, or probably 14 days after your surgery. Sometimes, because they release a nerve in your hand, that skin can get kind of sensitive and feel weird when you touch it. To help with that, you can expose it to different textures, starting with something soft like a nice t-shirt, rubbing it on that soft material, working your way up to coarser and coarser materials like corduroy or denim or a towel. Other things to think about, we just want to make sure you're not doing a lot of gripping, squeezing, lifting, pulling, until your body tells you that it's starting to feel better. Usually that's about the 4-week mark post-operatively. At that point in time, if you want to start some gentle strengthening, you can use a light stress ball or a little Play-Doh or putty to help with getting your full strength back. Again, if you have any questions, you can call the UVA Hand Center or talk to the hand therapists. Thanks.